All right. As people file in, thank you all for being here today. We'll get started in just a moment. You're welcome to introduce yourself in the chat with your name and where you're joining us from. Give it one more minute. If you're just joining us, you can add your name and where you're joining us from in the chat so we can hear about where everyone's coming from. Wow, someone from Madagascar. That's awesome. All right. Without waiting too much longer, we can get started and people will join us. My name is Maggie O'Donnell, and I'm the project manager at the Global Consortium on Climate and Health Education. And we are so happy to have you here today for this member learning collaborative featuring 6 students who are hard at work bringing climate and health education into their nursing and medical school curriculum. Before we get started, just some basic housekeeping. We have live interpretation in Spanish available. If you click on the globe at the bottom of your Zoom toolbar, it'll give you the option to listen in Spanish. We'd like to take this opportunity because we're talking about student education and student engagement. We have 2 active opportunities for students. One is the Global Consortium's Climate and Health Education Medical Student Fellowship. Actually, one of our former fellows is here presenting today. I'll put the link in the chat now to the website where you can learn more and apply. And then we also have the CRHE team who will be presenting here today. They have some new leadership positions available. So we encourage you to check those opportunities out and apply if you're interested. All right. Now we have, like I mentioned, 6 students who are presenting here today. We'll go from one presentation to the next, and then we'll have time at the end for audience Q&A. So we encourage you to ask your questions in the Q&A chat box as they come to you throughout the presentations. To kick us off, we'll have Allison Chang. Allison is a 4th-year medical student at UCSF School of Medicine and a project director with Climate Resources for Health Education, where she has been passionate about integrating climate change and health into medical education. She holds an MPH from Johns Hopkins School of Public Health, and prior to medical school, she earned her undergraduate degree in anthropology from Princeton University. And Matthew Lubke is a project co-director with the Climate Resources for Health Education and a 4th-year medical student from the Hackensack Meridian School of Medicine. So I will introduce the other speakers as we transition from presentation to presentation, but for now, the floor is yours, Allison and Matt.
Awesome. Thank you so much for the introduction. Let me go ahead and share my screen. Is everyone able to see my screen here? Awesome. Great. Well, we're really excited to share more about Climate Resources for Health Education. And just by brief way of introduction, again, I'm Allison. I'm from Southern California, here a 4th-year medical student at UCSF. Got involved with CRHE a couple years ago when I was first involved on the review team. And it's really been a highlight to be a project director this year for CRHE. And I'll go ahead and let Matt introduce himself as well.
Yeah, it's nice to meet you all as well. Thank you all for, attending today. I'm one of the other project directors. I'm a medical student at the Hackensack Meridian School of Medicine, which is just outside of New York City in New Jersey. So just to talk a little bit about what CRHE is and how it can help you advance climate and health education at your organization or school, we're a global health professional coalition based out of GCHE, whose mission it is to provide and create evidence-based resources that help to connect the gaps between environmental health and climate change education and professional medical education in places such as medical schools, pharmacy schools, and nursing schools.
And we saw that, despite there being a lot of interest from both faculty and students, there are a lot of challenges still for why climate isn't as universally incorporated into medical education. A big barrier being lack of staff time or funding to really support curriculum development, or feeling like maybe you might not have the expertise to teach these concepts in the classroom or have the materials to work with. And we know that many individuals, institutions are working to develop these resources. So what we really wanted to do was both to add to those resources and also really create a centralized hub of materials so people don't have to reinvent the wheel each time at their institutions from a curricular development standpoint.
The organization has 6 ongoing goals set to meet those challenges, including a repository of curricular modules, if you will, collaboration with several different institutions, such as Medical Students for a Sustainable Future and Planetary Health Report Card, which you may be aware of, having an open access website so that these materials are accessible to all, including diversity and inclusion, both among the team, interdisciplinary, having nursing colleagues, pharmacy colleagues, as well as being an international organization and partnering with people across the globe, as well as having our resources be kept up to date for any advances in the field of environmental health and climate change.
And as of now, we're developing content across 4 different curricular domains. So here on the right side, you could see organ systems and specialties, health system sciences, health equity, quality improvement. And throughout all these materials, we strive to weave in the themes of equity, preventative medicine, and aspects of global health as well. As Matt mentioned, this is all a free open access repository that really allows educators to incorporate content that meets their specific institutional needs. And in addition to partnering with, medicine, nursing, pharmacy colleagues, as Matt alluded to, we're also hoping to expand across diverse health professions as well, including dentistry. And you're also always welcome to submit any suggested topics to our email, which I'll link later on.
So to do so, we decided to implement 2 curricular components that can be easily implemented in professional educational settings that include but are not limited to problem-based learning cases and slide decks. At this point in time, we also have QI programs that are being developed to help people that are in continuing graduate level education implement them at their places of work as well.
Great. And just to share a little bit more about our process, we have a bit of a unique structure in which trainees and health professionals from all around the world could really build these resources with us. So we assemble teams of up to 3 trainees, so writers, and 1 practicing health professional who can serve as a faculty advisor to really co-create a case study or a slide deck on a topic they're all passionate about. These topics can range from, organ system sciences, so content in cardiology, dermatology, endocrinology, or more health system science topics. So those dive more deeply on sustainable health systems and social inequities as drivers of climate change. These folks are given templates and a user guide to really guide this content development. And once they develop those materials, they're reviewed for standardization by our internal review team, then sent outwards to experts in the field for content accuracy and evidence base.
Just to delve a little bit further into what our process looks like, we start with developing learning objectives that are relevant for a given topic or area of education, and really just think about how we can fulfill that with the content we're creating. Afterward, it's sent to peer review, which is really just formatting, ensuring that the evidence is up to date, and working on kind of the content as well. But most of that's done in expert review, where people that are knowledgeable to a certain degree in the field are able to review the content for accuracy and see if there's any areas for improvement, sending it back to the original author. At any points along this way, these are all volunteers, I should add, so the peer and expert positions are volunteered by students as well as faculty who are interested in the fields, as well as our authors, which we'll discuss later.
Great. And over the next couple slides, I'll just show how to navigate our website. It is climatehealthed.org. I'll have a QR code at the end as well. But to really get to our resources, you can click the resource bank here with the red arrow. Here you could see all the different filters that we have on the left-hand side. So there are different keywords. You can filter by health profession, level of trainees. And then here you could see as you click any of the sections that says download or learn more, it'll bring you to a Google Drive that has links to all those things mentioned. So a facilitator guide, a trainee guide, and learning objectives as well as the actual case study or the link to a Google slide deck.
It's also possible to search by keywords and tags. As you can see on this page, they're quite extensive. If there's anything that you're looking for in particular that's useful for your organization or geographic area, most of them are here, but there may be some additional ones on our website. Furthermore, just talking about the content, there are many different tags as well, such as, this is an example of a PBL case, and to give you some idea of what it may include, there's clinical vignettes in there, review of symptoms, and other, pertinent parts of a medical history that walk you through the case, as well as some facilitator prompts and guides in case you're a faculty member or a faculty member that'd be willing to help administer this at your place of education. To discuss a little case and further, you can see this is an example of a facilitator guide. As you can see, it gives prompts to the learning objectives that are relevant, has a little bit of a discussion on the learning objectives just in case you don't have the knowledge on the tip of your tongue, and also has all the parts where to prompt students on areas in which they could either ask more questions or a particular learning point that's salient to the case at hand.
Great. And in addition to detailed speaker notes on the slide decks or facilitator guides, which Matt just talked about, there are answers to learning objectives for educators to use in the classroom as well. And accompanying our resources, we also have an implementation guide that really helps just introduce people to CRHE, helps them tailor the resources to their specific needs, including, for example, steps on how to find faculty champions at your school, how to partner with student trainees who are already passionate about this work, how to link these materials to their existing curricular structures or different topics.
And right here is a QR code that gives a link to our implementation guide if you're interested in trying to make change at your organization. We believe at CRHE that students are the most powerful advocates for change in their own education. So sending emails to faculty members, deans are places where students have had success in the past, as well as partnering with other organizations that are in the climate and health field, such as the Planetary Health Report Card.
And just to expand on that last bit, a little bit of just to provide an example of working with key student allies to implement these resources. I think partnering with an existing PHRC chapter at your school is a great idea. These students might already have insights on gaps in the curriculum or areas where climate and planetary health content could really be strengthened. Just to introduce PHRC, this is another awesome student-driven initiative as well that really evaluates schools on the inclusion of planetary health across 5 different metrics. And so on our website, under the Other Resources tab, you can see where all the cases and slides from CRHE can address a lot of the Planetary Health Report Card metrics, and we hope that this allows for a bit more of a seamless integration.
And if what we discussed sounds like something that fits with your personal mission or educational goals, we are recruiting for CRHE leadership teams with several different positions. You can see the application that has the full description of all positions, requirements, and hourly commitments through this QR code here. We'd love to have any person on this call as part of our team, so please feel free to apply. Applications will be due by sometime next month, likely the 22nd.
And I can also quickly pop in the actual link to the Google form if you didn't have a chance to scan this QR code. And just to share a couple more, this is our email, climateresourceshealthed@gmail.com. The left QR code here is our website, so climatehealthed.org. And if you are interested in contributing as a writer, as a reviewer, as a faculty advisor, we welcome you to join us here by applying also at this Google link here. Great, and thank you so much.
Thank you so much, Allison and Matt. We are going to share all of those links in a follow-up email to those who have attended the call today to make sure that you have access to all of the great resources Allison and Matthew just shared. Next, I'm going to pass it over to the team from Columbia. Spotlight you, Hannah and Isabel. Great. So Isabel O'Malley Crone is a second-year medical student at Columbia University, Baglia's College of Physicians and Surgeons, with a lifelong interest in sustainability. She grew up in Santa Cruz, California, before moving to the Midwest to attend the University of Chicago. She's been involved in curriculum initiatives at UChicago and now at Columbia with a focus on building resilience to sexual assault on college campuses and on interdisciplinary sustainability campaigns. She is interested in surgery and hopes to one day reduce or even remove plastic waste in the operating room. Hannah Weinstein is a fourth-year medical student at Columbia University. She is a former co-leader of the Columbia chapter of Medical Students for a Sustainable Future and was the Global Consortium on Climate and Health Education's Fantastic Medical Student Fellow last year. So I'll pass it to you, Hannah and Isabel.
Thank you so much.
Thank you so much.
Okay, so today we are presenting on the integration of a climate and health curriculum throughout the Columbia VPNS Medical School curriculum and the resources that we utilize to do so. So the two of us make up part of a larger team that has been working on this curriculum integration. We'd like to acknowledge everyone who has worked on it, including Filippo, Sarah Bashley, and our two faculty mentors, who are Dr. Sorensen, the director of the GCCHE, and Dr. Cunningham, who's the director of Equity and Justice and Curricular Affairs at Columbia. This work could not be done without all of us, and it's been great to work with everyone. So this presentation is on the four phases that we went through to implement at Columbia specifically to share our process thus far. So to start off, we began in the spring of 2024. And the two first steps we started with were a literature review to understand what had been done at other schools, and then developing the learning objectives that would apply throughout the curriculum and proposing the curriculum to the deans. So specifically, when we were looking towards the literature, two things to note. Just the Lancet in 2022 noted that there were 3,000 peer-reviewed scientific articles published. So there's a really vast amount of data about climate and health education out there that medical students should be well trained to understand and interpret. The second important point to note is that there has been an expansion of the number of schools that have required curriculum of some sort. So in 2024, the AMC reported that 27% of MD granting medical schools in 2019 had some required curriculum on the health impacts of climate change, and by 2023 that had increased to 65%. So there's definitely growing momentum. Turning towards different schools that we modeled after, two papers that we focused on specifically were from Harvard Medical School, where they surveyed their student population to understand how the implementation of their climate and health curricular theme was perceived. And two of the takeaways were that 70% of the students agreed that the curricular theme was valuable, and 80% reported an improved understanding of the health impacts of climate change. It's really evidence that this can be done effectively. Other institutions we looked towards were UCSF, George Washington, and Brown, among others. The resources we turned to throughout the process included these, amongst others. So climate resources for health education, we referenced the slide decks and problem-based learning packets repeatedly as we spoke with different course directors in the different phases of our curriculum. the preclinical and clinical phases. We also turn towards New England Journal of Medicine, the AAMC MedEd portal, and occasionally to the Climate Resilience for Frontline Clinics toolkit from Harvard and AmeriCares. But really, I'd like to emphasize how much we utilize climate resources for health education, sending slides frequently to course directors as suggestions. So for the learning objectives in this first phase of development, we focused on the 4 common curricular themes that the learning objectives would fall under. So this included fundamental concepts, the second being interprofessional collaboration and communication, the third contribution to illness and disease, and finally application and practice when thinking about this curriculum. Not to go into terrible detail, but to highlight some of the learning objectives that we came up with. For the fundamental concepts bracket, we had 4. And in this phase of the curriculum, as we were proposing what we would do to the deans of Columbia, we really emphasized how these different learning objectives mapped to Columbia's own learning objectives, as well as the LCME standards, and how specifically each course could address each learning objective to make sure that we had that we're hitting all of the learning objectives throughout the curriculum without having unnecessary redundancy. So in this far right column, you see the abbreviations for the different course names throughout the Columbia curriculum. And we went even more granular to each course within these different phases and specified what we thought could be added to make sure that we had an equal distribution throughout the curriculum. These were the learning objectives for the second theme. We had 3, and I forgot to mention, these learning objectives were based off of looking at the medical students for a sustainable future and the GCCHE recommendations. So we combined those 2 amongst a couple others to come up with these learning objectives that we thought were appropriate for the Columbia curriculum. And then we had 1 for contribution to illness and 3 for applications and practice. And just to note, like as you go further into the curriculum, these more higher tier themes became more relevant. So in the clinical years and after.
Thank you so much, Hannah. So I'm going to just talk a little bit about what it actually looked like after consolidating all of this information. The next step was to bring it to the preclinical and clinical faculty and discuss ways that they could incorporate it into the curricula. And then also we added on to the research that we'd done by talking to local community organizations that know more about what's happening here in Washington Heights. So first, we were looking at the preclinical curriculum, and we talked to a lot of the faculty, and overall, many faculty members were very excited about the fact that this was happening. They really wanted to incorporate it. They just needed kind of a guide on how to do that. So that's where we came in handy. Especially, I think pulmonology is a classic example of ways in which the climate affects the health of our patients. And asthma is really prevalent, disproportionately prevalent in Washington Heights. So one example of something we did in the preclinical curriculum is we added a public health commute, which is a separate, isolated learning tool which all students have to take, and then they get assessed at the end, and it's added to kind of the grade, which at the end of the day, that's having something that's an assessment-based learning tool is really helpful in medical education. So then moving on to the clinical curriculum, we focused more on implementation instead of the foundational like learning of what types of illnesses exist and how they're affected. So in medicine, for example, there's learning boluses, which are a lecture-based series that happens longitudinally throughout the medicine curriculum. And we incorporated, our suggestion was to incorporate climate-related exacerbation for COPD patients. And then in emergency medicine, we had a similar kind of diagnosis to implementation recommendation that focuses either on input into a lecture or creating an entire simulation that's just focused on the climate disaster emergency response. So what are some other ways that, with this in mind and with these recommendations, there are a lot of different ways that we've been either successful or we're still working on getting this curriculum implemented. One is in the primary care clerkship. We have a Aquifer case. You might be familiar with Aquifer. It's a online tool that's pretty frequently used, especially at Columbia. It's very frequently used, just case-based. It presents case-based learning opportunities, and we suggested integrating one into the primary care clerkship that was specifically focused on chronic disease exacerbation. And this is just a really easy way to incorporate kind of CRHE learning resources and also any form of climate justice into the curriculum that already exists. Similarly, we mentioned the simulation the simulation case for emergency medicine. And then I mentioned that we talked to some community partners. One of them is called We Act, and they focus on environmental health, specifically in policies and projects in Washington Heights. So with that, we kind of have a step 3, which is October to December of 2024, when we continued with that clinical outreach in those courses, but we also talked about and began developing a elective for later in the course. And at Columbia, it's called D&I, but it's basically 4th year. It stands for differentiation and integration. And we also are incorporating and kind of eliciting student feedback. So what that looks like is very similar with these goals of foundations to implementation. And some of the electives that already exist are racism in medicine and wilderness, disaster, and environmental medicine. And we saw these as really great points where we could, again, put in suggestions of ways that we could use CRHE material or the other material that we were kind of drawing from. And then additionally, we've been developing a climate and health elective that is solely focused on the ways in which climate justice or climate change is affecting healthcare and our patients. So just going a little bit more into this D&I elective, the first week, it'd be a 2-week elective, and it's focused on a lecture-based series the first week focuses on sustainability and climate resilience in healthcare. So that's looking at strategies to reduce medical waste, which is something I particularly care about, and energy use, and reducing the carbon footprint overall with lower impact technologies that often are kind of more economically viable for the hospitals and things like that, and then really focusing on case studies of success stories. And then the second week is about advocacy and justice, where kind of what is our role in promoting this idea? Once we've identified structural barriers, how do we go about surmounting them? And that really focuses on the policy and the community-based aspect. So just to go back to, with all of these changes, we need to some way of understanding whether it's actually reaching the student body and whether people are excited about it, how they feel. And so we conducted a survey right at the beginning before the implementation of all of these, basically turning the guidelines that you saw earlier in Hannah's portion into questions and asking, how important is this to you? Things like that. And we have that initial, and we saw that people really do care. People want to see, faculty and students alike want to see these changes. And now we're going to do kind of a second, we have a 1 year and we're going to do a 2 year, most likely a second year or a second round of questioning how well is this coming through to the students. And we'll respond to that feedback. And of course, like continuously change the curriculum. So just to summarize everything, we had this literature review. We did a lot of the understanding of what the different options were for where we could implement climate change. Then we talked to we talked to curriculum advisors and faculty, and we talked to the local community members, and we really integrated this. And we even went further and we're developing an elective, and we really are just having to wait and see how the feedback goes. Thank you very much.
Thank you.
Thank you both so much. I have a lot of questions to learn more about how you made so much progress in such a short period of time. It's not easy to do when you're also in med school. So it's great to do. Right, next up, we have Madeline. I will spotlight you, Madeline, and you can share your screen while I introduce you. Madeline is a junior honors student and nursing major at the University of Delaware, and she worked on publishing an educational slide deck called Heat-Related Illnesses in Older Adults to the nursing segment of Climate Resources for Health Education in 2025. Over to you, Madeline.
Hi, everyone. It's so nice to meet you. I'm going to share my screen real quick. So this is me. Today I'm going to discuss my personal experience publishing with CRHE. I'm a junior nursing student at the University of Delaware, in the honors program. I currently work as a nurse extern at Christiana Care in the float pool. And last year, in 2025, I published educational materials with the nursing department at CRHE last year, with the help and guidance of UD nursing faculty and nurse fellow for GCCHE, Dr. DePhillips. So this was my experience. So normally Nurse 418 is a senior course offered for public and global health. I managed to convince my advisor to let me take it sophomore year because I was really curious and I had extra room in my schedule. And basically what Nurse 418 has for the honors section, they have an additional project which involves making an educational presentation on a climate and health topic. So my group, we decided to extend our project to be published by CRIG as an option on the website. And this was our presentation. So we did heat-related illnesses in older adults. I worked in a group with a bunch of senior honors nursing students. We also had a reviewer, and we had Dr. Phillips mentoring us throughout this whole process. So we started this project in March, and we completed it in about May. And then after we were ready, we pretty much gave it to Dr. DePhillips to be given feedback. After faculty approval, our slides were sent to the expert reviewer for feedback and review. And then after we got feedback from the expert reviewer, we made some more minor tweaks in the presentation, and then we sent it to the nursing segment of the CRG director for review and publishing on the website this September. And now it's on there. For me, this was my first publication ever, and overall, I would rank it a really positive experience. Getting to research in depth on physiological changes in older adults and how pathophysiological changes in older adults lead to greater vulnerabilities. Before starting this project, the nursing curriculum, I feel I was unaware of how severe extreme heat events could affect one's health, but now I've become a lot more conscious and understanding of how climate change affects population health as a whole, and especially with our underserved populations. The publishing process was intimidating going through the first time. It was very serious, very unknown, but having supportive faculty and reviewers giving great feedback made the process really educational and helped me understand not only more about heat-related illnesses in older adults, but proper way to publish materials and how we can better communicate to an audience. And I think the most important thing, because climate change is going to be, a growing social determinant of health, that we, educate our students more on it. And I think with social global inequality, that CRHE is a really good path and avenue to educate people on. And I'm really inspired for the future. So later in March, I'm actually going to present my educational materials to the current seniors in Nurse 418 to teach them about heat-related illnesses in older adults. And I also decided to do my senior honors thesis on assessing nursing students' understandings of older adults and heat-related illnesses. Right?
Great. Thank you so much, Madeline. It's really amazing to hear about how a project like your work with NCRHE then leads to more engagement and an eventual thesis project on climate change and health. I think that's a great illustration of how these projects can really lead to unexpected places. All right, as a
Thank you.
reminder, if anyone has questions for any of the speakers, you can add them to the Q&A box and we'll get to them in the next portion of the webinar today. So for now, I'm going to introduce Daniela. Daniela Herrera de la Fuente is a BS in nursing student at the New York City College of Technology. She practices as a registered nurse in geriatric ambulatory care at NYC Health and Hospitals. Daniela, over to you.
Hi, good afternoon, everyone. I'm going to share my slides right now. Can you see them?
Yes.
Okay, so a little bit about me. Well, this presentation is about climate change and nursing education, integrating climate health education at CUNY CityTech. I am a student, a BSN student at New York City College of Technology at CUNY. On my experience, this is my first experience about climate change, honestly. But I'm very happy. The last semester of fall 2025, I took client care urban class with Dr. and the professor in nursing department, Dr. Margaret Rafferty. So Dr. Rafferty integrates into the curriculum the concept of climate change by encouraging students
Programa del concepto de cambio climático,
in nursing to engage with nursing on the front lines of the climate crisis, education for action, as a foundation for learning and advocacy. So here, I have many ideas, many things, many feelings about this new climate change concept for me when I start to take the class. So as a nurse working in ambulatory care, I have witnessed the growing health consequences of climate change on vulnerable populations. For example, older adults in the clinic, they migrating to live with relatives abroad, exposure to unfamiliar climate condition after relocation, physical mental impacts from environmental, sudden exposure to extreme heat temperatures. So how we got that experience, how we can join this climate change education at CityTech. Well, Urban by Professor Rafferty had a lecture and a clinical hours. So as a student, we have the opportunity to join the nursing on the front lines of climate crisis during our clinical hours. Join the course of 10 weekly Tuesdays, live virtual 60-minute sessions. The lectures are delivered by nurses experts in the field. Video recordings are available following each session for asynchronous view. So from each lecture, you can learn about the effect of climate change on health outcomes. As a nurse, you learn how to take care of patients and develop new skills in nursing practice. Some of the lectures were about basic climate change science, vector-borne disease, water and food-related illness, extreme weather preparedness, and mental health impacts. So how climate directly drives health conditions? For example, respiratory illness, exacerbation of asthma and COPD from wildfire smoke and air pollution, heat-related illness, heat stroke, dehydration, and cardiovascular stress from extreme temperatures. Vector-borne disease, I will talk in a few minutes about dengue. Food insecurity, so environmental factors impact food, such as rising CO2, lower the content of zinc, iron, proteins, and B vitamins in the food. So malnutrition linked to environmental and economical instability. Mental health. I remember Dr. Meyers, in one of the lectures, she mentioned that climate change can lead to feeling of sadness, frustration, anger, insecurity, and hopelessness. Okay, so now, climate and vector-borne disease. So climate factors affecting vector-borne disease. Some of them are, there are 6 important factors, honestly. Temperature affects mosquito biting behavior, reproduction, and survival. Higher rates of irregular rainfall create new habits for mosquito standing water, for example. Humidity and elevation. Warmer conditions allow mosquito to expand into new regions and facilitate their reproduction. I'm gonna make the transition to a poster. This is the poster that Dr. Rafferty and I created a poster for, and we presented at CityTech 21st annual poster session. So as you see, it has abstract, climate change, and vector-borne disease. As all the factors, we were reading the material, it was a process to elaborate the poster, right? So you see here, what is dengue? Dengue is a viral disease caused by a biological vector 8 mosquito aegypti. So we include here in the poster the dengue virus transmission cycle, right? Where a person infected with dengue is bited, the mosquito bite this person, and then the mosquito became infected with dengue. And then more people unaffected by dengue, now they become infected person with the vector. So this is the cycle. Up to 4 million people may be every year infected worldwide with dengue. Symptoms of dengue: fever, nausea, vomiting, rash, insomnia, redness of the eye and throat, headache, pain of the bones and joints. Warning sign to look out for: bleeding from the nose, gums, blood in the stool and vomit, restlessness or fatigue. So important is here the education for the people, how to prevent the mosquito bites, use insect repellent, wear long sleeved shirts and pants. If you are traveling, pack insect repellent. The treatment must be, hopefully the person can be diagnosed as soon as possible with dengue, because as the virus disappear, right, but the people continue with some symptoms, it's very costly to diagnose dengue. So the treatment must be rest as much as possible, take acetaminophen for pain, drink plenty of fluid and stay hydrated, and see a healthcare provider and inform about your travel. So some key takeaways of daily practice. As a student and nurse, the lectures through Nursing on the Front Lines helping me to connect the impact of climate change in my real practice. Now I can apply more knowledge during the assessment about the climate change and its effect on health outcomes in geriatric clinic. Honestly, I think the nurses, when we start to work, we have maybe no motivation to move to different fields, but in the provision number 10 of Code of Ethics, we have the responsibility, we are accountable to relate and to learn from different skills, not only in our clinical setting. So my motivation now is totally different. I am very motivated with my patients, how assess the social factors, right? They can determine and put the people at risk, in more risk for the consequences of climate change. Advocate for vulnerable populations, stay informed, include emergency preparedness, inpatient and family education, screen for climate-related mental health, educate patients on prevention strategies, assess patients for climate-related risk factors, recognize climate change as a driver of health conditions in your patient population. Thank you so much.
Thank you, Daniela. It's great to hear your perspective as a person who's both a student and a practicing nurse. Right. Thank you to all of our speakers. I will ask you all to start your videos again so I can pin you all together and we can dive into some of the questions that have been asked in the Q&A box. If others have additional questions, you can always add them to the Q&A box or raise your hand and come off mute to ask your question. Right. There's a lot of you. I want to make sure I don't miss anyone. All right. So my first question I have was from the chat, and Allison and Matt, do you have opportunities for people who are interested in making climate resources for health education for veterinary medicine, or do you have any plans to do so?
I can answer this question. I don't think we have any plans at this time immediately. Mainly it's because we don't have as many connections with veterinary health faculty that are able to help us review and develop the materials as well as learning objectives necessary for us to make a competent and complete resource database. That being said, if the opportunity presented itself where there are competent faculty who are willing to participate that you know of, as well as students who'd be interested in the project, I don't see any reason why, we wouldn't be able to expand our current efforts.
That's awesome. So they could just get in touch with you if they think that they want to start that process.
Certainly.
Great. And then a related question, do the teams for building out the resources need to come pre-assembled, or could someone reach out saying they want to get involved and get matched to a team?
Yeah, so they would completely just fill out the Google form indicating all the topics that they're interested in. And we have a dedicated onboarding team that would pair up all interested writers and a faculty advisor together. So no need to do extra legwork on your own.
Thank you. All right. And then I think my next questions are for Hannah and Isabel. You had a lot of recommendations for bringing in community organizations to your process. And I wondered if you had any advice for other groups of students who are interested in building out similar resources for how they could engage with community groups on climate and health ed.
Yeah. I think Hannah has a lot, or Hannah is the person who met with We Act, so I'll definitely let her say a little bit. But I would say it was very helpful to actually have like an internal presentation because there was just a lot of people who interacted. And so some of the contacts that we got, they were people that I wouldn't necessarily have known to email or reach out to. So if there's those spaces already, getting involved in those spaces is a really good idea.
Yeah, and to add on that, we got in contact with them really because we had just heard of their work in the community. So I think similarly, wherever you are, you can just through some word of mouth or searching, find community orgs that are doing similar environmental health focused work. And they were really willing to meet. We met a couple times, came up with a whole project plan and pitched it to the faculty. Unfortunately, wasn't funded for now, but it's something we're planning to recircle back to.
Great, thank you. Right. My next question is for Madeline. How did you select the subject for your nursing resource, NCR? These acronyms are long. Nursing Climate Resource for Health Education. Was that a choice that your group was able to make, or was it assigned? And a related sort of second half of that question is, in bringing the materials to life, what kind of challenges did you face, and what kind of advice do you have for other students who are interested in getting involved in making these types of resources as an undergraduate nursing student?
So for the first part of that question, well, from my personal experience, I've seen in the hospital in the acute care setting that geriatrics is like one of like the biggest populations, in the acute care setting. So we had a discussion with our group on what population we wanted, and we had a peds class, we have maternity class, and we're like, we don't have a geriatrics like education class in particular. It's kind of like interwoven in the curriculum, but sometimes like me and my group's mates felt that like it wasn't fully enough. Preparation wise, so we wanted to create more materials in that field. And climate change is a growing concern among, health professionals in the field. So we thought, geriatrics and heat-related illnesses are both really important. So let's make educational materials on that. And then challenges, I think just like going through the review process the first time was like challenging because like we didn't really know what to do, but Dr. DePhillips was really helpful through that. It is really particular. I know CRG like wants like a certain font, like in a certain design with like a case study. Um, but um, but other than that, I think it was an overall good process. It did take a little bit, but it makes sense though because it needs to be rigorous because these are, educational materials to the public.
I think Madeline froze, but I think Maybe she'll be back in one moment. Okay, my next question is for you, Daniela, about your experience working on that poster and pulling out the resources from the nursing course. I wondered if you could talk a little bit about what it was like to translate something from the course into your poster session and what kind of resources you leaned on, either through your school or through the nursing course to make that possible.
Yes, so about the poster, well, when we start to create the poster, I already have encountered in my class from my clinical hours from the nursing front lines. So that was my first perspective to me. How can I engage with climate change? So when Dr. Rafferty proposed me the idea, so I start to read about dengue, right? Because we usually don't review those pathologies like per se that in nursing before we take the NCLEX. So I was looking for information about dengue, about climate change, and then the way to connect that. Honestly, yeah, I was looking for different resources, but when we finished the poster, I at the same time with my practice, I start to hear some, not too many, of course, like 5 patients that they were traveling and they were suffering about some different stuff that they never encountered our doctors in our practice in ambulatory care, like dengue or Zika. So when the patient really travel, they need this education from us. So really the poster and all the climate change sessions that I took from lines opened me a window to navigate in my practice. So I cannot talk about only just the poster, but the connection that I try to do every day in my practice, right? Because we have many immigrants here. So those patients, maybe they were affected by standing water. They don't have a lot of commodities at home. So we need to educate the patient how to prevent dengue. But also we need to educate patients at risk about, for example, cardiovascular disease, asthma, COPD that they mentioned now in the presentation, how they can affect it because climate change. That is my perception.
Thank you so much. It's great to hear how you were able to translate knowledge into action. And then it sounds like patient interactions back into knowledge and really create that poster through a lot of different sources. Allison and Matt, I think we have time for maybe one more question for each group. We have a lot of people joining here internationally, and I wanted to talk or hear from you a little bit about how international students can be involved in CRHE and if that's possible and what avenues there are for integrating requirements that might be a part of international medical schools into CRHE materials.
Yeah, that's certainly correct that we work with a ton of international students, and in fact we have a team dedicated towards the management of international teams of various different regions and languages depending on how it's best situated. We encourage many of the different people to work with us. Of course, we're a United States-based organization, but that doesn't mean our work is exclusive. Of course, our materials, as you saw, are written mostly in English. If you are interested in helping us adapt materials into different languages, we're always looking for people to help with our team or even to make them more suitable for your region. Some vector-borne illness cases don't cover what may be, most pertinent in your region, such as, for example, schistosomiasis in the Middle East or Egypt is something that's, changing, but not something that we explicitly cover in some of our vector-borne illness cases necessarily. So if you're interested, I encourage people to please, work through our contributor links. We're always looking for more members of our regional leadership team. So if you're interested in taking on a more leadership-oriented role, please apply for this next academic year, which is 2026 to 2027. And thanks for the question.
All right, great. Hannah and Isabel, you mentioned that you engaged with a lot of professors who were excited about this work, but maybe for some of the encounters you had with slightly more skeptical professors, could you talk about how you, encouraged them to use the materials and got them on board?
Yeah, absolutely. I would say we were very fortunate to not have too many skeptical professor or course faculty. Of the ones that we did, our approach thus far has been to really to approach each meeting with these are some ideas. What do you think? And like early on, quick assessment of their eagerness, and then go from there. So if someone was less eager, we tended to focus on really just like one thing that would be great to include, and then follow up again as they let or send them more references so they could read and give them kind of just more space to process of how the suggestion could be included. I think we were fortunate to not have too many of these interactions because we had really strong support from the deans of education, and they gave the curricular thread its own name, Climate and Health Equity at Columbia, and they like sent out communications like stating the importance of this. So I think that was really helpful. Just having great momentum building in the beginning of the process from students, like faculty mentors and administration to make those conversations happen less often.
And also, not to overstate the obvious, but like really having, like Hannah was saying, like really having robust clinical or curriculum support was so important for this. So like having that thread just means that like that's something that basically, even if the faculty are not like the most excited about environmental stuff, having the backing of the university is like really, really helpful. And also, if people needed more time, we could always just meet with them later on. That was the other thing we did.
That's great. Thank you. Great. Next, I have a question for Daniela. As a person who is both a student and a practicing nurse, do you have some advice for practicing nurses who are interested in learning more about these kinds of materials but don't quite know where to start?
Oh, yes. Well, usually the nurses with I work in that I encounter in my job, right? Most of them are taking classes for bachelor science nurse, right? So we need to start like communicate to them why it's important the assessment. For example, there is a big point at City Hospital because the place that I work, right? When we assess social determinants of health, that is the moment so important to assess. And because we have a big community that they are coming from different country, right? So it's the perfect moment so we can link a regular part of our job, like assessing the patient with climate change. And it makes sense because, for example, suppose during the summer, a patient come to New York and living in New York and the heat, right? And they don't have air conditioner at home. So it's part of our assessment as a nursing on new patient, on annual assessment, etc. This week, for example, after the blizzard, right, I am in charge and accountable to call ED follow-up appointments, right? And ask the patient how is their life, how they are going after discharge. And most of them were suffering from falls because the snow. So every nurse must be involved, but also different classes in the curriculum. I'm talking about my school, City Tech, right? It was a big beginning for me to know from the school, taking now the bachelor science about climate change, about from urban class with Dr. Rafferty. But there are many classes that there is a space for climate change. For example, now I'm taking leadership, right? And the last week we made a discussion about Code of Ethics, Provision 10 that I mentioned in my presentation. It linked the nurses with the responsibility to move forward, not just in your space, in your room, that you assess a patient for high blood pressure and that's it. No, it's not like that. So hopefully all the schools at certain moment can promote and make like the nurses aware that it's our responsibility to know about climate change. I am so excited to learn more. I think I just have maybe a 5% of knowledge. I need to complete that gap. But our practice every day, nurses should be encouraged to do the assessment in different ways.
Thank you so much for sharing that perspective. And it's exciting. Dr. Rafferty is also on this call, so it's great to have some teams. And I think Dr. DePhillips is also on this call, so it's great to see the connections between mentor and mentees. Madeline, I have my final question for you, and then we'll wrap it up. I know we're talking a lot about the specific benefits of learning more about climate change, but I wondered if you could zoom out a bit and talk about some of the other skills that you were able to develop over the course of building these resources, that maybe you hadn't gotten to build in other parts of your nursing education.
I think the biggest ones were teamwork and working with an expert reviewer. I think a lot of we don't really get the opportunity to make a lot of presentations in the nursing program because it's more about taking tests and going to clinical. So being able to make a project with a group of people, I think, was a really important aspect, especially on an academic topic, because we don't really get to do that often. And I think the expert reviewer part was definitely a new portion of adhering to certain standards and adhering to publication standards. Again, this is my first time ever publishing anything ever. So it was just a completely new experience. I think this was a good first step into maybe publishing a paper. I do want to do an honors thesis, so I think this was a good first step into, the publishing world. If that's a route that I may want to take.
Great, thank you so much. I hope everyone can join me in thanking all of our speakers today for taking time out of their busy professional and student schedules to be with us and to share all of these great resources and the stories from their journeys as climate and health student leaders. We will send a follow-up email with all of the resources students mentioned today. And if you have any additional questions, you're welcome to reach out to me at the GCCAG and I can pass them along to the presenters. Thank you and have a great weekend.
Thank you so much. Thank you.